Hi, so my name is Maddie and I'm an osteopath and Pilates instructor. And today I'm going to be doing a 10 to 15 minute video on my 5 best exercises for pelvic stability. So we're going to crack on and start. So we're going to lie on our backs, knees bent but hip width apart. So they're not really wide and they're not together, they're just separate. What you're going to do now, really important, there's 2 variations of this exercise. If you have osteoporosis or osteopenia, you're going to do variation number 2. If you don't have those conditions, then you're going to do variation number 1. Okay, so both variations, you're going to squeeze your bottom, squeeze your core. Variation number 1, you're going to roll up through your spine, so your bottom is in line with your knees. You're going to hold it here for a couple of seconds, and then you're slowly going to roll back down. However, if you do have osteoporosis or osteopenia, variation number 2, still squeezing the bottom and the core, you're just going to go up with a flat back and come down with a flat back. So none of this rolling up and rolling down. Okay, so we're going to do 10 together. So squeeze your bottom, squeeze your tummy, breathing in and then breathing out as we start this exercise. Good. Holding it here and then slowly coming back down. Now we're going to try and incorporate our breath. So breathe in to prepare, out to come up, in to hold it here, and out to come back down. Don't forget to keep squeezing that bottom. 7 more, in to prepare, and out to come back up. Really squeeze, push those hips up towards the ceiling, in to hold it here, and then out to come back down. Good. In to prepare, and out to come back up, in to hold. Good. And out to slowly come back down. 5 more, in to prepare, and out. Squeeze that bottom, squeeze, 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 holding it here, making sure you really feel that bottom squeezing and coming back down. Good. 4 more, in to prepare, and out to squeeze, lifting, 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 into hold, and out to slowly come back down. 4 more, into prepare, out to come up. Good. Into hold, and out to come back down. Good. 3 more, into prepare, feel that bottom burn, and out to come back up. Really, really try and squeeze, keep your pelvis nice and still as it gets to the top, and coming out as you exhale. Last 2, into prepare, and out to come back up, in to hold it here, and out to come back down. Last 1. Are we ready? Squeeze your bottom, squeeze your core, lifting up. Good. Holding it here. We're going to hold it for 8, 7, 6. Keep that bottom nice and high. 5, 4, 3, 2. Keep squeezing, and 1. Coming back down. Fantastic. Okay. So the next one we're going to do is a little bit varied onto this next one, onto that last one, sorry. So again, variation number 1 and 2 still apply. So you're going to come up into that glute bridge. From here, you're going to take your knees out, keeping your feet still on the ground and your bottom still raised. You're going to hold it here as you breathe in, and then breathing out, you're going to bring your knees back towards the center and then roll your bottom back down or come back down with a flat back. Okay, so we're going to do 10 of these as well. So breathing in to prepare yourself, and breathing out, coming up with your bottom, breathing in to hold it here, out to take your legs out, in to hold, and out to come back in and slowly come back down. Squeeze that bottom as hard as you can. You should be really feeling the burn now. Breathing in to prepare, and breathing out to come up, in to hold, and out to take those knees out. Well done. Keep squeezing that bum and coming back in and down. Good. In to prepare, and out to come back up, in to hold, nearly halfway there, and out to come out. Carry on breathing in to hold, and out to come back in and down. Good. 6 more, in to prepare, and out to come up. Think about how good your stability is going to be. In to hold, and out to take those knees out, in to hold, and out to come back in and slowly back down. Good. Halfway, in to prepare, and out to come up, in to hold, out to take those knees out, in to hold, and out to come back in and down. Good. In to prepare, and out to come back up, in to hold, out to come out, in to hold, and out to come back in. Fantastic. 2 more, in to prepare, and out to come up. Really squeeze that bottom. Keep those hips nice and still. Into hold and out to come out. Into hold again and out to come back in and down. Last one. Breathing in to prepare and breathing out to come up. Come on, you've got this. Squeeze that bottom. Into hold and out to take your legs out. Breathe into hold. We're going to hold it here for 5, 4, 3, 2, 1. Bring your legs back in. Keep holding. 5, 4, 3, 2, and come back down. Fantastic. Hopefully your bottom is on fire. So the next two that we're going to do is you're going to do it on your side, okay? So lying on the side, and you can choose exactly which one you want to do. So we're both going to start with our hips bent at 45, but our knees bent at 90. Now, if you get pain in the top hip, you're going to pop a pillow or two in between your knees, and you're going to keep that one here. If you get pain on the bottom hip, you're just going to pop something extra soft down, okay? So what we're going to do is you're going to keep your feet together. You're going to rest your head, keeping everything nice and tight, squeezing your bottom. You're going to breathe in, breathing out. You're going to lift, squeezing that bottom nice and hard, holding it here, and then coming back down. Okay, we're going to do 10 of these. Breathe in to prepare, and out to push up, into hold, and out to come back down. Good. Into prepare, and out to come up, into hold, and out to come back down. Good. Into prepare, and out to come up, into hold, and out to come back down. Good. 6 more. Into prepare and out. Squeeze that bottom. Try not to let your hips rotate backwards. Keep them nice and still. Into hold and out to come back down. Into prepare and out to come back up. Into hold and out to come back down. Good. 4 more. Into prepare and out. Squeeze that bottom as hard as you can. Into hold and out to come back down. Good. Last 3. Into prepare and out to lift. Into hold and out to come back down. Last 2. Into prepare and out to lift. Into hold and out to come back down. Last one on this side. Breathe in to prepare. Breathing out to lift. Into hold. And you're going to hold it here for 8, 7. Squeeze that bottom as hard as you can. 5, 4, 3, 2, and 1. Relax back down. Well done. Switch sides for me. So you're going to roll onto your other side. Knees are going to be together. Feet are going to be together, sorry. Hips are going to be bent at 45 and your knees are going to be at 90 degrees, okay? You're going to breathe in, squeeze that bottom and breathe out, lifting that top leg. Holding it here as you breathe in. And breathing out, coming back down. Good. 9 more. In to prepare. And out to lift. In to hold. And out to come back down. Good. In to prepare. And out to lift. Into hold and out to come back down. Into prepare, out to lift, into hold and out to come back down. Good. Last one, and we're halfway. Into prepare and out to lift. Good. Squeeze that bottom. Remember not to lift your hips up. Into hold and out to come back down. Good. 5 more. Into prepare and out to lift, into hold and out to come back down. Last 4. Into prepare, out to lift, squeeze that bottom as hard as you can, into hold and out to come back down. So we should be really burning. Into prepare and out to lift, squeeze, 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 into hold and out to come back down. Last 2. Breathing into prepare and out to lift, squeeze, into hold, keep those hips nice and still and out to come back down. Last 1. Breathing into prepare and breathing out to lift, holding it here for 5, 4, 3, 2, 1.5, and 1. Good. Come back down and relax. Oh, hopefully you should feel your bottoms really burning, okay? So the next one we're going to do is you're going to have to be on your hands and knees. Now, if you have any sort of hand or wrist pain, then you can put a few pillows or you can do this on a sort of bench and rest on your elbows. It is up to you, okay? So what we're going to do is you're going to be on your hands and knees. You're going to keep your hips facing the floor. Now, again, always squeezing our bottom at all times, okay? Watch that your back doesn't arch or doesn't hollow. It needs to be relatively nice and flat, okay? So squeezing in here and squeezing your bottom together. What you're going to do from here is you're going to slide one leg back just about a couple of centimeters off the floor, okay? One thing that I always see with this one is a lot of people lift their hips up, or when they take their leg out, they then drop that sort of core. So this needs to be nice and tight at all times. If you can't do this exercise without dropping, then keep it on the floor, okay? So that's either variation number 1, or if you can do that one, variation number 2 is taking it off the floor, okay? We're going to do 8 on one side, and then we're going to do 8 on the other, okay? So breathing in and breathing out, taking that leg off, squeezing that bottom into hold, and out to come back down. Don't let your hips twist. Into prepare, and out to lift, into hold, and out to come back down. Into prepare, and out to lift. Trying to keep your weight nice and neutral. Into hold, and out to come back down. 4 more. Into prepare, squeeze that bottom, keep that core nice and tight, sliding that leg out, into hold, and out to come back down. Good. 3 more. Into prepare, and out to come up, into hold, keep those hips nice and still, and out to come back in. Last 2. Into prepare, and out to slide out, into hold, and out to come back in. Good. Last 1. Into prepare, and out to slide out. Holding it here, we're going to challenge ourselves. We're going to do 8 little pulses up and down. 1, 2, keep that core tight. 4, 5, 6, 7, 8. Hold it here and slide it back in. Well done. That was a horrible one. So now we're going to go on the other side. Keep pelvis nice and tight, squeezing your bottom, breathing in and breathing out, sliding that leg out, into hold, and out to come back in. Good. Try not to lean on the other side either. Breathing in to prepare, and breathing out to slide out, into hold, and out to come back in. Good. Into prepare, and out to slide, into hold, and out to come back in. Really squeeze that bottom. 5 more. Into prepare, and out to slide. Don't let that tummy sink. Into hold, and out to come back in. Into prepare, and out to come out, into hold, and out to come back in. Last 3. Into prepare, and out to slide. Squeeze that bottom, keep those hips nice and still, into hold, and out to come back in. Last 2. Into prepare, and out to slide, into hold, and out to come back in. Last 1. Into prepare, and out to come out. Keep that tummy nice and still on that bottom. And now we're going to do our 10 pulses, okay? Small pulses. 1, 2, 3, 4. Squeeze that bottom. 5, 6, 7, 8, 9, 10. Hold it here, and then come back down. Nice. Well done. They are not the nicest of exercises, so well done. The last one we're going to do is we're going to sit on our backs, or lie on our backs, I meant to say. Bending the knees again. This one's quite a gentle one, but it still means you need to squeeze your bottom, okay? So your feet this time are going to be together, your knees are going to be together, okay? From here, you might want to pop your hands on your hips, because this is the most important thing. Your hips are going to face forwards, okay? So what you're going to do is you're going to alternate each leg. You're going to breathe in. Breathing out, you're going to take one leg to the side. Now, if you can't take it any further than about sort of, 35 to 45 degrees without moving your hips, that is absolutely fine. So the aim is to keep them nice and still and just let that leg drop without moving the pelvis. I think there is probably my maximum. Squeezing in my bottom and then coming back up, okay? Also very important that when you bring that leg back up, that the leg that's remaining doesn't come and help that leg, okay? I see that a lot in my Pilates classes. So we're going to alternate legs, and we're going to do 8 on each side, so 16 in total. So breathe in to prepare, and breathing out, squeeze that bottom. Let that leg just drop until it can't go any further without lifting your hips. Into hold, and out to come back Now the other side, in to prepare, and out to drop. Keep that pelvis nice and still, squeeze that bottom, in to hold, and out to come back up. Good, in to prepare, and out to come out. If that hurts your hips, then don't go as far, in to hold, and out to come back up, in to prepare, and out to come out, in to hold, and out to come back up. Good, in to prepare, nearly halfway, and out to come out, in to hold, and out to come out, in to prepare, out to come out. Don't let those hips move, in to hold, and out to come back in. Don't let this other leg move as well. Good, halfway, in to prepare, and out to come out, in to hold, and out to come back in to prepare, and out to come out with the other side, squeezing those bottoms, keep that hips and those core nice and still, and coming back out, in to prepare, and out to come out, in to hold, and out to come out, squeeze that bottom, in to prepare, and out to come out, squeeze, 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 in to hold, and out to come back in. Good, one more time on each side, in to prepare, and out to come out, in to hold, and out to come back in. Last one, in to prepare, and out to come out, in to hold, and out to come back in. Well done. We're now just going to stretch out our glutes. So we're going to do my favorite stretch. So you're going to pop one leg crossed onto the other. So just relax this leg here first of all. If you've had a hip replacement, then you're going to keep your hips here. You're not going to push it any further. Doesn't matter if you don't feel the stretch, it will still be doing something, okay? But we want to keep the integrity of that hip joint. If not, you're going to place that hand on this knee and you're going to push the knee away from you. Now, hopefully you feel a stretch roughly around this sort of glute area, but if not, do not worry. If you don't feel the stretch, you're going to bring the other knee up and pull until you feel the stretch in your buttock, and you're just going to hold it here for 45 seconds. So go ahead and pause this video and just count to 45 seconds on your own. Okay, and then you're going to switch legs for me. So pop one leg across the other one. Again, hip replacement, stay here. If not, you're going to push down. You're going to hold it here if you can feel it. If not, you're going to bring that knee towards your stomach and then holding it here. Again, pausing the video for me for 45 seconds and then relaxing back down. So thank you for watching and partaking in the video. I hope you found that useful for your glutes, and I hope you think about me tomorrow when you wake up with a sore glute.